Hey y'all, Kayla Mowdy, Doctor of Physical Therapy, coming to you with another Monday educational moment. As promised last week, I'm going to talk about muscle teams. So the shoulder is the easiest example for this. Around the shoulder blade, there are 12 muscles that connect to the shoulder or the shoulder blade, and when you reach overhead, the muscles work together to help make the shoulder blade also help with the overhead motion, because the actual joint here can't do all of the work. The shoulder blade has to move as well. So when you have a neck muscle that's tight, some of these muscles connect to the neck. When that muscle is tight, it can't go up as it should. So some other muscles start working too hard to pull it up. And those muscles get tired. That wasn't their intended function. A lot of them are small stabilizers, not necessarily movers. So when the movers start working as stabilizers start working as movers, and sometimes movers have to work as stabilizers if there's instability in the joint and there's too much motion, things get out of whack, and we just call that unbalanced muscles. Some things are too tight, some things are too weak. So this is a method that we use as physical therapists. We assess these things and we find what's too tight and we find what's too weak, and we give you a plan to stretch those things or strengthen those things or work on stability drills. This works for the knee, this works for the athlete. Athletes may have an area of weakness that they don't realize that's keeping them from excelling in performance, and physical therapists, most of us are trained and very comfortable with teasing these things out and giving you things to do to work on to correct these imbalances in muscle strength and length. Y'all have a happy Monday. Bye, y'all.